Hey everybody, Dr. Schultz from the Centennial Schultz Clinic with another weekly update. Thanks so much for checking in. Today we're going to continue our series on the thoracic spine. In particular, we're going to be talking about the anatomy and the three major parts of the thoracic spine that you should know. So let's get started. So what is this thoracic spine? Basically, it's the mid-back. As you can see here, it's below the neck, which is up here, but it's above the lumbar spine. So it's that middle section that can be quite debilitating and cause significant pain. So what are the three major parts of the thoracic spine? Let's take a deeper dig. They're the vertebral bodies, basically the bones that compose the spine. They're the discs that are in between the bones, and then some very important joints that your doctor may have never mentioned. So the first major part of the thoracic spine is the vertebral bodies, basically the building blocks that stack on top of one another that make your spine. They're numbered from T1 downward, and they're depicted here. You can see them right here and here. Now, the vertebral bodies are susceptible, like everything else in the body, to injury. They can be fractured or they can have misalignment. Sliding forward, which is an anterior listhesis, or backwards, which is a retrolisthesis, having significant injury to both the nerves and potentially the spinal cord. The second part of the thoracic spine that you really need to know about are the thoracic discs. These are shock absorbers that are sandwiched between the vertebral bodies. They, as I said, are an important shock absorber, and they're based upon, in terms of labeling, the two vertebral bodies that they're sandwiched in between. So for example, between the T6 and the T7 is the T6-7 thoracic disc. So for numbering, that's important if you have a disc herniation at T6-7 as opposed to T1-2. So you may see that on a report, and I just wanted to let you know that. The disc itself is composed of two principal parts. The number one, or the inside, is what's called the nucleus pulposus. It's kind of a gelatinous center, and it acts as a shock absorber. The second part is this annulus fibrosus, which is basically the sidewall. It just holds everything in. Now, both structures, the annulus as well as the nucleus, can be injured. And when that happens, you can either have a disc bulge, a disc herniation, or a disc extrusion. So it's very important to know that the second most important part in the thoracic spine is the disc. Now, the third are the thoracic joints. A joint, by definition, is where two bones come together. The function of a joint is for movement and stability. And in the thoracic spine, there are three very important joints that you need to know about. Number one, the thoracic facet. Yes, you've heard me talk about facet joints. They're in the lumbar spine, they're in the cervical spine. But the thoracic facet joint is a special joint. It is a paired joint, which is on the right and the left. It occurs at every single level of the spine. It's two bones that are lined with cartilage, no different than your knee or your hip. And it allows for stability and movement. Now you can see here in my depiction here, here's my needle, and this is the joint itself. This is the thoracic facet. The thoracic facet is very difficult to inject because of the angle. In addition, if the needle strays ever so slightly to this side, you run the significant risk of collapsing or puncturing the lung. That's known as a pneumothorax, and it can be associated with problems with your blood pressure, with your heart, and it oftentimes is treated with a chest tube. Not a great day. Now, the thoracic spine has two very, very special joints, and they're as a result of the ribs. The ribs actually come over and join the vertebral body. And where they do so, they create two very special joints that you've probably never heard of. The first is what's called the costotransverse, and it's depicted here. And this is from bottom up. You can see that this is the rib, and it articulates right here, and then it continues on. Right here is the transverse process of the thoracic spine, and where the transverse process meets the rib head is a very important joint, which can be a source of significant pain and dysfunction. The other joint is where the rib actually comes in and articulates or joins the vertebral body, and this is called a costovertebral joint. So in summary, there are three thoracic joints: the thoracic facet joint, the costovertebral joint, and the costotransverse. All three joints have important capsules and ligaments that provide critical support. Unfortunately, all three of these joints are susceptible to injury, degeneration, and pain. So in summary, there are three major parts of the thoracic spine: the vertebral bodies, the vertebral discs, and the joints, which include the thoracic facet, the costovertebral, and the costotransverse. But really the million-dollar question is why should you care? This is why thoracic pain can absolutely be debilitating. It can keep you and a loved one on the sidelines. The thoracic spine is very poorly understood, and there are very few providers that provide very advanced treatment. Why? Because of the risks. Your lung can collapse, and there are other significant complications. Any of the three structures we mentioned can cause pain and keep you at the sidelines. So if you or a loved one continue to have thoracic pain and no one seems to know what to do, the Centennial Schultz Clinic, we are experts in the evaluation and the treatment of thoracic pain. Thank you so much for your time. Just realize all three structures can be a cause of significant pain and limitation, and we'll be happy to evaluate you. Thanks so much.